Good evening. Welcome to our panel, Abortion Across Borders, Abortion Without Borders, which is an international panel on transnational abortion travel and on borderless solidarity. It is my great pleasure to be your moderator today. I will introduce myself in more detail after a short introduction of the topic of the panel today. So in this week of Safe Abortion Day and after the last events, also internationally, we have been reminded about the reality of unintentionally pregnant women and all people who get pregnant traveling around the world, being forced to travel across national borders to be able to access safe abortions. So from Ireland to Great Britain, from Poland to Germany, from Brazil to Argentina, from the USA to Mexico. Some of these routes have been traveled very long and some of them are very new. So when we look at the international context of reproductive rights, countries like Argentina, Ireland, or South Korea have improved significantly in the recent years, whilst other countries have been experiencing a very terrible backlash, as the situation we all know in the USA and in Poland, of course, but also other countries in Europe like Hungary. So this exercise of reproductive rights and the struggle for reproductive justice happens, as we said, in a global context across national borders, and that brings a lot of questions and a lot of issues that we are going to discuss this evening. So the idea is to try to give an overview of the different abortion routes that are currently being traveled. We will address also the fear of repression for those affected and also of their supporters. And we will focus also on what it takes to take up this struggle for reproductive justice together and what we can do also as activists and supporters to support people who need a safe access to abortion and to be able to exercise their reproductive rights. So before I introduce our panelists, I will briefly introduce our organizers of the panel tonight. So one of the organizers is Vita Dengue. So this is the Saxon part. This is a region in Germany for our international friends of the Heinrich Böll Foundation. So Vita Dengue is a political foundation and their task is political education. And they're close to the German party Die Grünen, which is the Green Party, and what they want and what they educate for. So their values are close to the Green Party. And their topics range from ecology, democracy, feminism, and reproductive rights and reproductive justice are also central to their work, such as other feminist topics. Our second organizer is Pro-Choice Dresden. Pro-Choice Dresden is a political feminist group which is based in Dresden, which is a big city in the region of Saxony, and that addresses reproductive justice concerns in the local context. They organize protests, for example, against the silent march of Christian fundamentalists, but also demonstrations, for instance, also for Safe Abortion Day. So their main concern is to raise awareness and to mobilize. And to do this, they use protest actions, but also different information formats like our panel this evening. So by now, I think you understood. I am your moderator tonight. My name is Sarah Dutch. I am a filmmaker, and today, together with my collective, the queer feminist film collective Kinokas, I made a film called Wie wir wollen. The English title is Choices Voices, that came out last year, and that addresses the access to abortion in the German context, but also wider questions of reproductive justice. There is a link to our website underneath the stream, so if you are interested into seeing the film or knowing more about our collective, feel free to visit our website. We'll be happy to see you around in the cinemas. So now it is my great honor to present our three panelists. First, we have Silvia De Sordo. She is a PhD in social anthropology. She is associate professor at the University of Barcelona. She has worked on health, gender, and reproductive politics since her PhD in France at the École des Hautes Études des Sciences Sociales in Paris. Her research interests encompass contraception, abortion, and conscientious objection in Latin America and Europe. Her most recent publication on the topic of abortion is A Fragmented Landscape, Abortion Governance and Protest Logics in Europe, which is a volume edited with Joanna Michtal and Lorena Anton. So from October 2016 to August 2022, she has led a mixed methods research project funded by the European Research Council titled Women Traveling to Seek Abortion Care in Europe, the Impact of Barriers to Legal Abortion on Women Living in Countries with Ostensibly Liberal Abortion Laws. So this is the study that we are going to talk about. Hi, Silvia. Very nice to have you.
Hello.
Hello. Okay, so our second panelist this evening is Steph Black. Steph is a Jewish activist and writer based in DC, Washington, where she fights to expand abortion access and reproductive justice. She writes newsletters, funds abortion, and shares information about self-managed abortion. Her words have appeared in Bustle, Mrs. Magazine, the progressive magazine Vice, Lilith Magazine, Alma, and more. And Steph is proud to be the vice president of the Emma Goldman Clinic, an independent feminist abortion provider in Iowa. So if you want to know more about Steph's work, you can sign up for her newsletter and also see her website, which is also listed beneath the stream. And she lives in Washington with her fiance, Hannah Ruth, and all the typos in her work can be attributed to her cat, Goose. Hello, Steph.
Hi there. Thank you so much for having me.
Our last but not least panelist is Christina Katsura. She graduated from the University of Warsaw and is a postgraduate from the Foreign Relations Institute. She is engaged in the Federation for Women in Family Planning. She has been active in the field of sexual and reproductive health and rights as the women's rights defender for over 25 years. She is author and co-author of many publications, reports, and articles on sexual and reproductive health and rights in Central and Eastern Europe. She is strongly engaged into advocacy activities on national and international levels on the liberalization of anti-abortion law in Poland. She was also very engaged into the Black protest in 2016 and 2017, and she is a member of the European Society for Contraception and Reproductive Health and Program Council of the Congress of Polish Women. Currently, she holds the seat of the president of the Foundation for Women and Family Planning Federa and Astra Network. Hello, Christina.
Hello. Thank you for this introduction.
Thank you for being here. So before we start with our panel, I will give a few more technical information. So for all the people who are watching the stream, feel free to ask some questions to our speakers via the tool Slido. You can find the link also beyond the streaming. So you click on slido.com and you need to enter a code. This is very important. So the code is 1508561. I think it is also listed beyond the stream. And you can also find the access in the chat next to the stream and in the description of the event. So yes, the code is below. So just about the structure also, I think it's important for the questions. First, we will have a 20-minute discussion with Silvia, mostly about her study, with a few questions that we have prepared. Then there will be time also for questions from the audience. Then we will move to a discussion with Steph Black about her activities in the US and the situation in the US at the moment. Same format, like short impulse from Steph, then a few questions, then some questions from the audience. And same format then with Christina about the situation in Poland. Then there will be some time for a discussion between the three of us and to take more questions from the audience. I also wanted to invite you, if you have some specific questions about the German context, you can also feel free to ask them, and I will be happy also to answer them. Okay, so let's start. Silvia, would you like to start with your presentation?
Okay, thank you very much for inviting me, organizing this interesting event. I think it's very important actually and timely to discuss challenges to fundamental rights like abortion rights now in Europe as well as in North America and elsewhere. But I think it's important and urgent now to talk about that. And so I'm glad that I can contribute somehow to this discussion based on the research that we have just finalized. I have prepared a few slides just to kind of help the people who are attending this event to kind of visually understand the study that we have done and how we have done it. So I don't know, Nathaniel, if you can share the PowerPoint so that I can start to talk about the study. Not sure. Yeah. I don't know if I'm supposed to see it or if. Sorry, just all fine. Okay, so I can start because I cannot see the slides. So yes, okay. So I have been asked to present at this webinar the main results of a European mixed methods research project on barriers to legal abortion that I have led between 2016 and 22. I'm the principal investigator on this study, and I've also carried out research in Spain on cross-border travel for abortion care, but I've not done this study alone, on my own, of course. So on the first slide, you should see, I'm not saying it, but I'm sure you are, the names of all the other researchers who have contributed to the first phase of this project aimed at studying the phenomenon of cross-border travel for abortion care in Europe, on which I will focus today. And I'd like to thank them all for their amazing work, very challenging, as you will see, as we shall discuss, even if they cannot be here with me today. So next slide. So historical public health and social sciences studies show that pregnant people have traveled to seek abortion care within the borders of their own country or across national borders, both before and after abortion started to be legalized in the 60s in Western Europe, as well as in other world regions, including North America, Australia, and New Zealand. This shows that abortion travel is not only about illegality, but also other forms of restrictions imposed on women and pregnant people. When I started to collect data on abortion travel in Europe for my research, which was finally funded by the European Research Council and has been hosted by my university in Barcelona, there were only few reliable data available. You should see on the slide now that according to publicly available data that we found back then, over 3,800 non-Dutch and non-British residents from countries where abortion is legal sought abortion care in the Netherlands and England between 2017 and 18, mainly German, French, and Italian residents. I thus decided to investigate in depth this understudied but relevant phenomenon by a large multidisciplinary mixed method study in between epidemiology and anthropology on barriers to access to legal abortion and abortion travel, focusing on Western European countries where abortion is legal. We wanted to understand why so many people were leaving their countries where abortion was legal to access abortion care elsewhere. Next slide, please. So on the project's homepage that you should see now, you can see the main cross-border flows on which we focused our study. As you know, in the European Union, only a few countries have a very restrictive law on abortion. These countries are highlighted in red on the map. Poland is in red, of course, and Malta is not visible because it's tiny down there, but it also has a very restrictive abortion law. So Polish and Maltese pregnant people, and Steph and Christina, we talk about that for sure later, who seek abortion care, mostly self-managed medication abortion at home safely, thanks to transnational organizations such as Women Help Women or Women on Web, or some of them also travel abroad, and increasingly so from Poland, thanks to the support of a number of organizations under the umbrella of the big organization that is Abortion Without Borders. However, for our project, we decided to focus on Western European countries where abortion is currently legal on broad grounds or women's request. And these are highlighted in green on the map on our website, darker in the case of countries with more restrictive laws. We considered more restrictive the laws that establish stricter gestational age limits for abortion on women's request or on broad grounds, mandatory pre-abortion waiting time periods, and or counseling. Next slide, please. When it comes to abortion governance and restrictions to access, Europe presents, as you can see, a fragmented landscape. On our map, we indicate the gestational age limits established by the abortion legislations of the countries involved in our study as they are defined by the laws. However, laws rarely specify whether pregnancy must be calculated from last menstrual period or from conception. Consequently, in some countries, such as France and Germany, the legal time limit is interpreted by health authorities and abortion providers as weeks from conception, while in others, such as Italy, for instance, it is calculated since the last menstrual period. Now, there is a 2 weeks difference between these two ways of calculating gestational age, which can represent, as you can imagine, a huge difference for pregnant people seeking abortion care. It's not the same saying 12 or 14 weeks, or 14 weeks or 16, yeah? Few European countries, such as England and the Netherlands, have not established a legal limit at the end of the first trimester. Others, such as Spain, provide access to second trimester abortion also in case of psychological problems of the woman more easily than in other countries. For these reasons, these countries are the main destinations for cross-border travel for abortion care. France has extended its legal limit for abortion on request up to 14 weeks from conception in March of this year, and so the number of pregnant people traveling from this country abroad may decrease in the next future. In one of the publications based on our project that is currently under review, we argue that the legislations that establish gestational age limits implicitly recognize the embryo fetus as a person that acquires rights during pregnancy and do not recognize women as full and autonomous moral and political subjects. As legal scholars and advocates for abortion rights have highlighted, time limits are based on the assumption that women are irrational and irresponsible because they would take a longer time to decide whether to terminate their pregnancy if they did not have to respect the legal limit. While the data on abortion from the countries that do not have a gestational age limit at the end of the first trimester, such as the Netherlands and the UK, clearly show that this is not the case. Next slide. So legal time limits are problematic because, as the results of our study show, they are the main reasons why thousands of pregnant people travel across borders in Europe from countries where abortion is legal. Our study's results show that early, easy access to abortion care in the first trimester is not always guaranteed, even in countries where abortion is legal, due to a number of factors, mainly lack of access to easily accessible, reliable information on abortion care. This was the case particularly for Germany and Italy in our study. Lack of services in specific areas, sometimes due to widespread consensus refusal of care among health providers, which was the case particularly, but not only, of Italy in our study. Lack of access to some methods, for instance, medication abortion at home in the first trimester or surgical abortion in the second trimester. And finally, mandatory waiting times, which can lead people to exceeding legal time limits. Our findings also illustrate that people's bodily social time, irregular periods, sometimes combined with distressful life circumstances, such as separations, for instance, as well as care time of living or future children and other relatives, often clash with legal time limits. And the erroneous medical interpretation of bodily pregnancy signs can also contribute to delays that lead to exceeding these limits. Furthermore, they show that cross-border travel implies serious financial burdens. On average, just for you to understand, an abortion procedure abroad in the Netherlands or the UK can cost 900 euros, and I'm not including here the cost of traveling. And also logistical challenges, including family work arrangements, which can provoke distress, can force people to disclose their abortion against their will, and lead to serious delays in accessing care. These delays, as well as some travelers' attempts to self-induce abortion prior to traveling with potentially unsafe methods, and I'm not talking here about self-managed medication abortion via telehealth, I'm talking about something else, can increase risks for their reproductive health. Our results also show the importance of key social agents for overcoming barriers to accessing abortion care and traveling abroad, including pro-choice health professionals or organizations with which we are sharing our findings. To conclude, our study raises questions about the impact of fragmented policies on abortion in Europe, the social and gender inequalities that these policies exacerbate, and the meaning of safe abortion and reproductive justice when cross-border travel is necessary. And to conclude, next slide, you can find more if you're interested in the results of our study and the publications based on our study on our website, europeabortionaccess.org, in the research and finding section. Thank you.
Thank you so much, Silvia, for this overview of the finding of your studies. So before we go more in depth into the content and the findings of the study, we wanted to ask you a short question about methodology. So which methods were used, and did you also have like first-hand interviews with people who were traveling across borders, or did you use secondary data? And was there anything in your findings that was particularly surprising for you as a researcher that has been working on this topic for many years?
Yeah, so in order to understand the reasons why pregnant people traveled abroad for abortion care from countries where abortion is legal and their experiences, you know, with abortion seeking and cross-border travel, we used self-administered surveys and in-depth interviews, both, which my research team and I conducted wherever possible at the main destination clinics that we selected based on the existing data in England, the Netherlands, and Spain. So we did almost 2 years of data collection in each of these countries in selected clinics that received high numbers of people coming from other countries. Yeah? If it was not possible to administer the survey or do the interview at the clinic for time constraints and other kind of constraints that I will talk about in a minute, we offered the study participants the possibility of filling out the survey or having the interview later remotely via phone or internet. We recruited only participants over 18 years of age, even if there were minors also who traveled abroad to these clinics, because it was very difficult to obtain ethical clearance by the European Research Council to include minors too. And this was a pity, but this is what it was. Our research participants traveled to the destination countries mainly from Germany, France, Italy, and Belgium, but we recruited also a subsample of travelers from countries with restrictive laws for comparison purposes. In particularly from the Republic of Ireland before the legal change in 2018, and also a few ones, but just a few from Malta and Poland. However, our main focus were countries where abortion was legal on broad grounds. Yeah. And we found particularly challenging conducting our research at the destination clinics because we could recruit potential participants and administer the survey or conduct the interview only before they entered the surgical ward and started the medical procedure, which means that we had very limited time for data collection there, because then most of them left the clinic and went home, of course. And one thing that kind of surprised us, and we couldn't really explain very well, was the fact that many of our German participants who kind of participated in the study mainly at a clinic in the Netherlands were reticent when we kind of offered to interview them, or were afraid of potential negative consequences, or it was probably not always clear to them whether there may be some legal consequences for the fact that they were traveling abroad, not because of their participation in the study, while this was not the case for other women coming from other countries. But this was something that we could not really explain and understand very well. So you have asked what surprised us, and this was something that I recall that was kind of surprising for us. But otherwise, I think that one of the thing that was also surprising for us at the very beginning, not afterwards, was to see so many women traveling from countries where abortion is supposedly legal, and also meet women who may have obtained an abortion at home, like almost one third of our survey respondents still were within the gestational age limits to have an abortion on request or broad ground in their country of origin, but they were delayed by a number of barriers that they faced. And so they exceeded this limit, not because they found out they were pregnant after the limit, which was the case for the majority, but because they couldn't access information timely, or the services timely, or they had to undergo several appointments, or for a number of reasons. So this was particularly concerning, let's say. Yeah.
Thank you very much. So what are the concrete implications and consequences also for the study's findings for national strategies? Like, is there a way that your findings can make their way into legislation or policy making?
Well, yes, I think so. So over the last years, we have actively engaged with the political debate on abortion rights and access in the main countries of interest of our project, where we have been presenting the results not only at academic, but also at non-academic and political debates. And we have discussed at these debates our studies participants' difficulties with different kinds of barriers to accessing abortion care and abortion travel, and also their opinions on these barriers, as well as on abortion legislations, because this is another topic that we have investigated. We asked them what they thought about, what they knew and what they thought about the abortion legislations in their own countries, and including on gestational age limits. And we think that the voices and experiences of pregnant people seeking abortion care should be heard much more than it is usually the case, because they are often marginalized and forgotten when abortion access and rights are discussed in public debates. While we think that it is crucial that the regulation and organization of abortion care is built in order to meet their needs, and with us hope that our research findings can contribute to improve access to good quality care and prevent travel. And this was actually the case in France. I mean, we have actively participated in the political debate on the reform of the abortion law in France over the last 2 years, and particularly in the debates on the extension of gestational age limits for abortion on broad grounds. We contributed to convince the National Ethics Committee, to which we presented our findings, to support this law change and recommend the extension of gestational age limits to the government. And we were very happy about that. And actually, gestational age limits were finally extended in March of this year. I think that this shows that research can have a serious policy impact, and that we need to build strong alliances in these difficult times that we are going through between advocates for abortion rights and researchers. It's true that our study did not focus on medication abortion via telehealth, which became increasingly important during the pandemic, including in countries where abortion is legal, some of which started to provide it, in order to avoid mobility, and traveling, of course. I think that this is another topic that should be also more investigated, because it's very important, of course, and maybe an alternative to traveling, at least up to a certain gestational ages. Also this year, the WHO has recognized that first trimester abortion, medication abortion via telehealth, is a safe alternative to clinical-based medical abortion. I mean, even if it's provided by activists and not by health professionals. So this is also another important topic, and we are actually exploring this not only in Europe but also in Latin America with a new project that I'm leading, and I hope I will be able to share the findings of this new research maybe in 1 year or so.
Thank you, and congratulations about France. It's very good to hear also some good news from time to time.
Oh.
So before we move on to our next panelists, we have a question from the audience. So for living in Spain, some laws next to others came into force in Spain. Harassment of pregnant women outside abortion clinics and of clinic staff can be punished with up to 1 year in prison. Women in the age of 16 will be able to terminate an unwanted pregnancy without parental consent. Spain is one of the countries where huge progress has been made in terms of reproductive rights. Can you please explain the current developments? How are these developments possible considering a huge Catholic base, and also considering this backlash that happened also a few years ago after there was the liberalization of abortions in 2010?
So first of all, I must say I'm not Spanish, I'm Italian, even if I've lived here for the last 10 years. So of course I have participated in the debate here and followed it, but maybe there are some nuances of the debate that I don't get entirely. But so yeah, Spain is traditionally a Catholic country. But it's also a country that has a very strong anarchist and communist tradition, both, and has had 40 years of dictatorship, right? Fascist dictatorship, and historically it's very recent. So there is a very strong also anti-clerical sort of sentiment, and the left and the parties on the left have been actually pushing for defending and also strengthening sexual and reproductive rights, right? Much more than in a neighbor country, like for instance, Italy, my own country, I mean, they have been able to promulgate laws allowing access to marriage, assisted reproduction, and adoption for non-heterosexual couples and single people, which is not the case in Italy. Then the 2010 abortion law, the more recent law eliminating the previous distinction between sexual abuse and aggression, known as only yes is yes. So there is a sort of a left that really takes care and push for strengthening sexual and reproductive rights here, and this is visible, and it was visible also when Gallardón, the Minister of Justice, tried to not ban abortion but restrict abortion in 2013, right? And there were very strong protests back then that kind of stopped this law project. But it's true also that the same popular party that Gallardón came from was divided internally when they started to really debate these new law projects. So it's an interesting country. I mean, you cannot just classify Spain as a Catholic country and that's all, because France is also Catholic in traditionally, but we don't think about France, I don't know why, as a Catholic country, right? So, I mean, these are categories that we should maybe think of more critically. And as for the debate now, so basically the change concerning minors, it's interesting because it's just, they are trying to reestablish what the 2010 law already established. I mean, that law established that minors did not need parental consent, but after Gallardón tried to kind of restrict abortion and failed, the Pepe government managed to at least obtain these, forbid minors from obtaining access to abortion without parental consent. So they're sort of going back to the 2010 law, which is good. But now they are also discussing other issues, like, for instance, consensual refusal of care and kind of trying to provide abortion care more at public hospitals and less at private or independent clinics subsidized by the state. It's an open discussion. I think it's problematic, also based on my previous research on consensual objection here in Italy, because one of the ways in which they have avoided the negative consequences of high rates of consensual objection in the public sector here, as well as in the Netherlands or the UK, is by creating specialized clinics, that where you have specialized and well-trained health professionals providing this service, and where you will not face consensual refusal of care, of course, because nobody would hire someone who will not do the job, right? While what happens in countries like Italy, in which abortion is mainly provided at public hospitals, most obstetricians gynecologists, because unfortunately only obstetricians gynecologists are allowed to provide abortion care there, no midwives, no GPs like in France, for instance, then most of them object, but not always or only for moral or religious reasons. I mean, there are several other reasons. One is that this is considered an extra job, let's say, something to which you can say no while you are obliged to do all the rest. And it's not very interesting, technically speaking. And it's not, of course, continues to be stigmatized also socially. So it's also perceived as a dirty job. So why should one do that? And also we are talking about health professionals who are not always engaged, with sexual reproductive rights and do not receive any training actually, in abortion care, and so there are several issues there to be tackled. And so it's very delicate, I think, also the debate that is going on here on that, I mean, whether it is better to have most abortions provided in a specialized sector subsidized by the state anyway, because here women and pregnant people do not pay for an abortion, even if they go to these clinics, or if it's better to kind of oblige all public hospitals to provide this service. The point is, what kind of service then you will be able to actually provide, who will provide it and how. I mean, it's complicated, yeah.
Thank you so much. I think this topic of who is allowed to actually provide abortions and how do we tackle the question of conscientious objection, we'll probably also talk about further during the discussion. I would like now to move over to our next panelist, Steph. Thank you so much for being with us today. Would you like to give us maybe, before we start with some questions, short impulse about your work and maybe an overview also, just to recapitulate what happened in the last weeks in the United States since Roe v. Wade was revoked by the Supreme Court?
Yes, quite a bit to talk about, but I will start with an introduction. I'm Steph. I use she, her pronouns, and I live in Washington, D.C. I do a lot of abortion-related work in many different capacities, including being an abortion funder, meaning I fundraise money for abortion access here in the US. I also drive patients. I'm a clinical support volunteer, which means that when pregnant people travel to DC to access abortion care, in order to cut some of the costs in their travel costs and their appointment costs, I'm part of a collective that will actually volunteer to drive them to and from airports, train stations, further away in Virginia, for example, which is a neighboring state, to their clinics, to local hotels. Sometimes before the pandemic, we actually hosted patients in our own homes. We do cash assistance. We help coordinate childcare for people who have to travel with their children. And we really help with a lot of those practical, logistical concerns that are raised when somebody has to travel for abortion care. For example, Washington, D.C. is one of the I think pre-Roe, there were only 5 clinics that would provide abortion past the second trimester of pregnancy, and 2 of them were in the DC area. So patients would travel from quite a ways to get to DC to access care. So that meant we have a lot of patients who we drive, because at that point the procedure is very expensive, and often those patients can't really afford to spend money on taxis and Ubers and other sort of rideshare apps like that. So that's where we come in. Additionally, I'm a writer. I write about abortion frequently. I have a weekly column at the Progressive where I cover all sorts of abortion related issues, including Kansas, which I'll talk about, which is a state that became the first state to vote on abortion after Roe fell. And they voted to protect abortion, which was incredible and somewhat unexpected, actually. And I think that's it. I'm going to get more into more details in these questions coming up, so I'll leave it for that. And to give a brief overview about the nightmare of abortion access and abortion rights in the country over the past couple months. And this is also something I will talk about further on, but there has been a massive anti-abortion movement to overturn Roe on a federal level since Roe was created. There has been backlash against Roe for decades. And as we approach the 50th anniversary, those efforts really picked up with the new Supreme Court justices that were put on the court by former President Donald Trump. He made a promise during his campaign back in 2015 that he would only nominate pro-life justices, anti-abortion justices. And when it came time, it's been a waiting game for the anti-abortion movement. And when it came time for them to decide on a case that had the ability to overturn some of the last protections of Roe, which were a pre-viability ban. So previously states couldn't implement a ban before viability around 22 weeks. So you couldn't ban abortion before 22 weeks. And that was overturned. So because that was the last provision of Roe as a whole was overturned in this case, Dobbs versus Jackson Women's Health, which was the abortion clinic at the center of this. There has been immediate backlash, and I'm also going to be talking about this later too, but there's been lots of protests, there have been elections, there's an upcoming election, and lots of really inspiring things that have happened and very sad realities that pregnant people seeking abortions are now facing.
Thank you. So you described earlier when you presented yourself that you are an abortion funder and also an abortion doula. So maybe can you give a few words of explanation of what that looks like and what that is, maybe for people who don't have this context, and how it is, how this translates concretely into your everyday work?
Yes, I forgot to mention that I'm an abortion doula. I don't do as much in-person doulaing during the pandemic, but it is something I'm very much looking forward to continuing on. But I do what I would consider a lot of digital doulaing. A doula in general, a birth doula, is somebody who provides emotional support to people who are laboring, so people who are giving birth. And an abortion doula, very similarly, provides that same kind of support, that emotional support, to people who are having abortions. So that can take a wide variety of avenues. So you can be in the procedure room. So I've been in the procedure room with people having abortions while they're under anesthesia. I've sat with people who have had medication abortions, but the digital doulaing is just my way of saying that I also help people who are self-managing their abortions and are talking to me via encrypted apps like Signal. And I help them and support them and, you know, provide reassurance and talk through their sadness and their concerns and their joy. And I help them, sometimes it's even earlier than that, I actually help people access abortion medications now that, you know, abortion is not legal in many, many states in the United States. People are turning to self-managed abortions more. And so I help people access those medications as well. And in terms of abortion funding, the United States does not have healthcare, really. We don't have socialized healthcare, which means that we pay out of pocket, really, or it comes out of our paychecks, right, to be able to access abortion or access healthcare. And you can't use federal dollars. So if you're on public insurance, Medicaid or Medicare, you can't use that to cover the cost of an abortion, which can range anywhere from $150 US to $20,000 US, depending on the kind of procedure, how far along in pregnancy you are. And a lot of private insurances don't cover the cost of abortion either. And many states, I think 26 states in DC, don't let you use state Medicaid dollars. So abortion is expensive, and the only way to really pay for it is out of pocket, which is where abortion funds come in. Abortion funds are collectives that raise money and distribute money to people seeking abortions, to people who need abortions who can't afford it. Like I said, abortion is very expensive here in the US, even with pills, even through self-managed avenues. So to be able to fundraise that money is a really radical act of community care. We are able to say, you know, fuck the state. We decide what happens. We decide our fate. We help each other. We take care of each other. And that includes providing the practical access to abortion care, whether it be funding, whether it be childcare, whether it be getting patients across the threshold of an abortion clinic. We take care of ourselves. So I'm very proud to be a part of many abortion funds and do a lot of peer-to-peer fundraising to help raise funds to make those things possible.
Thank you. Now, just coming back to something you talked about a little bit at the beginning in your presentation, can you give a rough outline of the current travel movements? I know it's very complicated because the situation is changing also really fast in the different states, and also maybe talk about that some of the states have also been talking about travel bans and what that actually means. And maybe in the second part of the question is also looking at this question through an intersectional lens, also what Silvia kind of already talked about. So how does people's different social positioning also influence the access that they can have to abortion services?
Mm-hmm. Absolutely. So to start off with just a brief overview about what travel looks like generally, since Roe fell, so Roe, the last federal protection of abortion, states have been able to decide whether or not abortion remains legal within that state. And one thing to keep in mind that I've been thinking about too is that for the mostly European viewers of this live stream, the United States is enormous. The United States is geographically huge with very, very little infrastructure for travel. You know, we have highways, right? But that requires driving, which takes a very long time. You know, Texas is a state where you have to fly to get from one end of the state to the other. And we don't really have good trains. We don't really have good public transportation. Flying is very expensive. So on a practical infrastructural level, it's hard to travel. And since Roe fell, patients now have to travel an average of 276 miles each way to access an abortion in this country. That's not even towards their preferred clinic, that's to the nearest clinic. and there's a difference. So practical support, like I mentioned, is part of what I do. Practical support collectives work really, really hard to make abortion practically accessible on an infrastructural level. So a lot of practical support collectives have had to shift their function a little bit in states where there are travel bans, right? Right now, I don't think any state has been able to quite yet enforce and actually criminalize anyone for traveling, as far as I know. But that doesn't mean that the threat and the danger of traveling across a border to another state is real. That is a real danger and a real concern. There are states who are responding to that by passing their own protective laws for abortion travelers. I know New York is one of them. Connecticut is one of them. I think Rhode Island is following suit. Chicago is a city that's doing it. So there are states that are preemptively saying, if you travel to this state for an abortion, we will not prosecute you. We will not hand you over to the authorities of your state. We will not aid in the investigation that might arise from your travel here, which is complicated, right? Like, these are crossing a state border to commit a crime is a federal crime. So it's going to be a very tough, confusing legal landscape for the people who do travel and who do need to travel. Another statistic that I think is worth sharing is that there's going to be an estimated 300,000 people that need to travel for abortion care every year after Roe. And about a third of those people, so about 100,000 of those people, will need financial support and practical support in order to make that travel, which is an enormous amount of money. And we're finding that abortion funds are running out of money. It's a really tough time to be trying to make abortion happen in this country. And of course, that is compounded very strongly, exponentially, by the fact that most of the people who are seeking abortions are people of color. They're Black and Brown and Indigenous people who are already disadvantaged in this country and already have the hardest time accessing abortion care. And because Roe has been overturned and abortion is now, questionably legal everywhere, even if you're in a blue state or a safe state, there are still so many avenues in which a person can be prosecuted and subjugated to criminalization for talking about abortion, for sharing info about abortion, for things like that. So it's going to impact the people who are already the most impacted by restrictive laws and by the, asinine barriers that have already existed to prevent abortion, such as waiting periods, such as having to travel, such as mandatory counseling, such as, being exposed to clinic protesters. Most clinics don't have bubble laws or, space around the clinic where protesters can't access. So it's compounding issues that have already existed that we have been already trying to solve. But the reality is too, that I think is worth mentioning, is that Roe was a really shoddy protection to begin with. Roe didn't actually do much. It was the last vestige of federal abortion protection, but didn't make abortion accessible. And many parts of the country, especially the south of this country, has already been living in a post-Roe reality for a very long time, because abortion has not been accessible for people in the South, especially already marginalized people like young people, immigrants, undocumented people, queer people, people of color, those who are already low income. And without getting a little too dreamy and a little too optimistic, I do think that the fall of Roe has given us an opportunity to go beyond just talking about how bad the situation is, but has allowed us an opportunity to imagine a world and a country in which we can have abortion access, right? This is an opportunity to think bigger, to understand what can we rebuild better? What can we build better next? So as awful as things are, and they are, we do have the chance to improve upon the realities that we were living in before.
Thank you so much. So just for our European audiences, because we don't travel in miles, but in kilometers. So 376 miles, I just looked it up. It's 600 kilometers on average. So yeah.
Far.
Very far. Yes. So a question came from the audience, but maybe we keep it for the last part of the panel so that we have also enough time for Christina and to talk about the situation in Poland, because Sylvia might need to leave at 7:30. So Christina, thank you so much for being with us. Maybe before we start, as a starter, can you give us again an overview of the situation in Poland right now?
Good evening to everyone. Thank you for the invitation. Sorry for my voice, but I just passed the cold. The situation in Poland right now is extremely difficult if we are talking about access to reproductive health services. But starting from the very beginning, just shortly, I would like to tell you about the political background of this situation, because Poland is probably the only country in which abortion is totally political issue. This is not the issue of women's rights, not access to health, to reproductive health services. This is clearly political issue. And in early 90s, when we, during the period of economic transformation, we paid for this, because Polish Catholic Church just wanted politicians to repay for its engagement into the Solidarity movement and into the collapse of socialism in Poland. And women's reproductive rights were the first issue they rose. So finally, just speaking very shortly about this, politicians and Catholic Church in Poland changed the law. They called this law a compromise, but it was a compromise without the participation of women. We organized a referendum and collected 1.5 million signatures, which were totally neglected. And in 1993, we had a new law, very restrictive law. Abortion was allowed only in 3 narrow cases. And this law was still lasted till 2016. In meantime, there were many attempts from both sides, from our sides to liberalize this law, and from fundamentalist sides to make the law much more restrictive. But politicians, they loved this compromise. They said that this is the great law because finally they agreed this law with Polish Catholic Church. 2016 was the year of just extremely important for Polish women, because we rebuilt our Solidarity movement. During past 20 years, women didn't believe that we can do something, that we are able to change the law. So they organized access to abortion just, for them. We forgot about the uneducated women living in small towns and villages with no money, with no access to internet. Just arrange, we are the European country, so it's not difficult to go to other European country to get access to legal and safe abortion. But it depends on your economic status, of your education, of your knowledge of languages, and so on. So in 2016, when our fundamentalist organization, Ordo Iuris, delivered the draft civic law on a total ban of abortion in Poland, including criminalization of women, including the criminalization of women after even unintended miscarriage, total lack of access to emergency contraception and regular contraception, and no sexuality education. You know, they made one step too far. And Polish women finally awoke. We organized a huge black protest, standing in the raining air on streets, blocking streets, not only in Warsaw and huge towns, big towns, but also in small towns and villages. So the whole country were protesting against this draconian law. And for the first time in our history, the ruling party, you know, they were frightened women and they stopped this law. So we won this battle, but huge war is still ahead of us. It was not for a long time, no, but of course we are very happy that we secure this law, even if it was restrictive, but not a total ban of abortion and no criminalization of women. After this, two years ago, you know, they did the same as it was in the US. There was a draft law which ruling party was afraid to deliver to the discussion in parliament because they didn't believe that it could pass. It was the law which excluded from abortion the cases of fetal abnormalities. And they didn't believe that even their voters, even their members of parliament would be against this. So they decided to ask the question, the Constitutional Tribunal, if this exception is constitutional or not. Of course, it was in time of pandemic. So they took advantage of this because they were sure that we won't go out in the streets. But we went into streets and we protested 2 days. But we could do nothing because it was a constitutional tribunal, which is called by us so-called constitutional tribunal because it's not the democratic constitutional tribunal. And they excluded this exception for legal abortion when fetus is seriously damaged. This night, when this draconian law was announced, this is the terrible night for me and for us in the foundation, because women, gynecologists, husbands, partners were calling us the whole night. Some of them just received the results of prenatal tests. Some of them were before the tests. Some are planning pregnancy. Women were scheduled for the abortion procedure in the hospital, and they were told to leave hospital because the law changed. So there are many, many tragedies of women. Gynecologists called us and asked what to do. Can we continue or not? Could you advise us? We have no procedure how to do with these scheduled abortions and how to do with these results of prenatal tests. What to do? And one gynecologist just told me that he had a woman scheduled to have abortion next morning, and when she heard in TV that it's forbidden, she went into the lift in hospital and she was going up and down and crying that she will not stop if they don't help her. So, you know, this is one of these. Still, we have the same cases. But of course, we did our best to find a gap in this law. And still, we have the exception for legal abortion when there is a danger for a woman's health or life. So we organized a group of friendly, so-called friendly psychiatrists who consult women and then issue a statement that continuing on this pregnancy will result in a threat of a woman's mental health. And some hospitals just accept these certificates, but not every. It's just a couple of hospitals. And in this way, we can help women from small towns, villages, having children, not having money. Others go abroad, mainly to Germany, Netherlands, England, Spain, even France. But, you know, it's also expensive for them. So Abortion Without Borders just help some of them, but not every. It's not easy. But, you know, even if they come back to Poland, back after the abortion, they are afraid to go to hospital. They are afraid to check, you know, the state of their health, because they are afraid that they will be punished. So we educate every day, thousands of times, that still women in Poland are not punished. With the same, say, Ukrainian women, because they also are afraid of this. You are not punished, only gynecologists and so-called helpers. Of course, there's a huge stigma in Poland for many years, but you know, right now we have a kind of victory. Today, the research poll showed that 66% of Polish people are for legal abortion up to 12 weeks of pregnancy. So, you know, we have the support of the society, and we count for the future election. Maybe it will change, because this time it was really extremely difficult to have a government built by one right-wing party solely, with a majority in the parliament, and with the great need of strengthening patriarchal system in Poland.
Thank you so much. You touched on so many interesting topics, also this topic of legislation and how it is being interpreted, because actually the legislation in the UK is very similar to Poland, but it's always also interpreted in a way that the abortion is then being provided on the grounds that it's putting into danger the mental health of the woman or the pregnant person. And also this idea that it's a question of democracy, that in most places also now where we see the backlash, there is a majority for free and legal abortions. I just wanted to come back to something that you mentioned, that the women or the people who seek abortion are not being criminalized, but the helpers and the providers are. Can you maybe talk about some, because there was a very prominent case of Justyna Wudrunska, I hope I'm
Wydrinska, yes.
Wydrinska, and that her trial has been pushed from July now to October. So what is being discussed around this? So would be one access, like one question about the criminalization of the helpers, and the other one would be about, you said a lot of women travel, and also by talking with Ciocia Basha here in Berlin, one of them, the activist, told me also that a lot of women stay in Poland and do the self-managed abortion with the pills, because it's easier actually than, for instance, to get an abortion in Germany, where the system is also very complicated. So maybe if you could touch on these two topics briefly. Thank you.
Yeah, of course, medical abortion is right now very popular in Poland, you know, because we collaborate with two huge organizations based in Netherlands, Women Help Women and Women on Web. And they are very, very helpful. Of course, we as an NGO working on reproductive health issue a special brochure in Polish, how to use this medical abortion. And we, of course, work via our hotline as a kind of abortion doulas, but not personally, but of course, I mean, oh, I have a very huge bleeding, what to do, how long it will be, you know, many, many questions, especially when a woman does it for the first time. So she's frightened, she's afraid to go to a gynecologist. And the second, we just encourage them to visit gynecologists after medical abortion, especially if it's more than 10 weeks of pregnancy. You know, because it happens just for your sake, for your health. Go. No gynecologist is able to discover that this was intended miscarriage. You know, if you are afraid, you can just tell it that it was unintended miscarriage. So you are never punished. Me, I could be punished. Gynecologists could be punished. There is a thin line between help and giving information. So I was, you know, called to the police and prosecutor many times, and they asked me many questions about women on web or women help women and about our hotline. And so I tell, just open our website and our social media. These are information directed to the society, to the whole population. This is not a special information to Miss Maria, for example, or somebody else. So right now is a silence. Coming back to Justyna, of course, this is against Polish law, what she did, because she sent pills to a woman who asked her. This woman was in a very sick relationship, and her husband just took over pills and went to the police. And on the envelope with these pills was the back address of Justyna, that she sent this. I think that it will be nothing, just, you know, they want to, the kind of threat to other Polish women, because it's so popular. You know, Polish government, Ministry of Health, Polish politicians, they are not interested in abortion. They are interested only in law. If we have very draconian law, it's quite enough for them. You know, the president of ruling party said, oh, abortion is accessible. It's quite enough to cross Polish border. So you see, this is the kind of, I don't know, not stigma, but hypocrisy, you know, that they, no law, no ban will stop abortion, but put it into danger, because this is the reproductive injustice. Your access to safe reproductive health services, mainly abortion, depends on your economic situation.
Thank you so much. So I would like now to go to the second part of the panel, where we address some questions to all of you. And maybe you can also, if you have a question for one of the other panelists, it would also be now the time and space to do this. So the first question is coming back to the travels and the routes. That what we see in this, the historical development, is that we have routes that are being reversed. So women used to go from Mexico to the US to access abortion. Now it's the other way around. Women are going from the US to Mexico to have safe abortions. We also had the routes that in Germany, in the GDR, German women used to go to Poland during socialist times to get abortions. And now it's also in some cases the other way around. So what conclusions do you draw from it? How do you evaluate these shifting routes when we look at the evolution of this topic?
Should we all respond, or how do you think?
If you would like to say something, maybe you can just raise your hands, and then I take you, like the digital hand or the real hand, as you wish. But please, Sylvia.
Okay. So, well, of course, you know, the flows, you know, of people change depending on the political situation, you know, and on abortion provision on the ground also, and how abortion care is provided, you know, in different contexts. And as I said, for instance, in the case of Western Europe, hopefully we will see less French residents crossing the borders now that they have extended, for instance, gestational age limits there, so things may improve. But I think that what may really change this would be also kind of simplified access to medication abortion at home, at least until a certain gestational age. And this is something that is being, discussed also in different European countries where abortion is legal. It's not easy because during the pandemic, sort of governments were sort of obliged to find solutions or were under pressure at least. And only a few ones actually took this step, of really starting to provide state-funded medication abortion at home. But we had some examples like the UK, the Republic of Ireland, France, for instance. And I think that this should be explored more, of course. And in the context of Europe, I think that also another thing that should be explored is how we can make these travels covered, and the procedures abroad covered. If we can somehow use the right to health of European citizens, to allow them to have their procedures abroad funded, this is something that should be discussed and explored at the EU level, I think. This is another thing that would be important, I think, to discuss. Yeah.
Christina, Steph, would you like to react to this question or to what Silvia said?
Yes. No, it's very difficult to say, just to answer simply on this question, because it depends on the country. The direction changed, but as Silvia said, this is a political problem. It depends on the government in the country. And as you see in many European countries, we have right-wing governments, and of course their attitude to abortion and women's rights is generally anti-choice. So that's why abortion in Poland is forbidden, and in other countries with fundamentalistic governments. And I think that this is not the problem of abortion and women's rights, and this is not the kind of backlash. I think that this is the just beginning of the huge war between two different ideological points of view. And we are in half of the way, 50% are pro-choice and another 50% are anti-choice. And it depends on our fight and on our successes if we live in democratic countries or if we live in patriarchal system. So abortion is one of the main components of the patriarchal system, because our body is not our body, don't belong to us. Somebody else wants to decide what to do, how many children, where and when. This is not democracy. So I think that this is a huge war, which right now was strengthened by right-wing governments in Europe also. But I have also a short question to our colleague from the US. Do you expect that your president will help American women?
No.
No.
President Biden has yet to even say the word abortion out loud. He took far too long to respond to the overturning of Roe v. Wade and has yet to exercise the full extent of his executive powers to protect abortion access. He's done some things. There have been 2 executive actions, executive orders that he has passed that have really not done enough, that don't actually make a material difference in the lives of people seeking abortions. And despite the ongoing pressure that we've been putting on him to do more, he hasn't really done much. The easiest being he could declare a state of emergency, and yet he has not done that and likely won't. And I think that's going to be an issue for him come the election. I think he had an opportunity, he had a window of opportunity to step up and to finally talk about abortion and didn't, which has been something that, during every election cycle, there are organizations that say, which presidential nominees, which people running for office have said the word abortion, and he has never said the word abortion publicly. And in fact, does not, while was pro-choice publicly, is Catholic, right? And is pro-life, has pro-life beliefs, right? To a certain extent. So I unfortunately don't see President Biden actually being much of a help in the months to come.
Thank you. So now we have a question from the audience, which is a person that is asking if some of you have any leads or any connections to activists or supporters in Egypt, would be the first question. And the second one, how to build a support network or how to join one. Like I know, Christina, you mentioned Women on Web. So if you have like any other support networks that you would like to mention, and maybe also to talk about this question of solidarity and how we can support each other across borders. How does this look like?
Well, I can definitely answer about the practical support in the US. There's, and actually it's a resource that could be used internationally, apiaryps.org. apiaryps.org is an online resource and directory of all of the practical support collectives in the United States. But they also have a really comprehensive database of information and a guide on how to create a practical support collective. So specifically around driving and transportation mostly, but many practical support collectives do much more than just transportation. So apiaryps.org is a really great place to start if you're looking at doing practical support and helping people access abortion care, especially across borders.
In Europe, we have also Abortion Without Borders. This is the huge initiative which pay women for transport, for hotel, and for abortion, late abortion, in clinics in Netherlands and in Great Britain, mainly. I heard also about Germany, but 90% of abortions are done with pills. This in Poland. These late abortions are repaid by Abortion Without Borders, and they collect money via Europe and all organizations and individuals. Many these difficult abortions with fetus abnormalities are still done in Polish hospitals, but every case has to be monitored by us, by Federa. So we provide women with access to friendly psychiatrists. Then we just tell her step by step what to do. And finally, we call to hospital, or our lawyer or me or somebody else go to hospital and say that this is against the law. and Polish hospitals, that they are afraid. Private media, private TVs, they are afraid that and usually say, we will call and ask TVN, for example, or other station, private, and you will tell about this woman whose pregnancy is in lethal state, because this is the acrania, very, very dangerous abnormality. And a woman is a really poor mental health. So, but this is a very thin line. Sometimes we have to educate women how to talk to psychiatrists, because they said, oh, I will perform a suicide. I don't want to live any longer. So psychiatrist in such cases is obliged to keep her and to drive her to hospital. So we said that you can do nothing. You are looking in one point. You don't go to your work. You don't care your children, your husband. Just, something weaker to do this. But women are very helpful in Poland. So we have Abortion Dream Team, this initiative, which is a part of Abortion Without Borders, to this new initiative in Netherlands and in England. And we have many also private contacts also with women, because when this draconian law was introduced, we received many mails, information, phones from women living in Norway, Sweden, France, Netherlands, Belgium, France. These women who remember time when they went to Poland to get access to abortion. And they said that I will give my room, I will pay for abortion of Polish women. Just contact me, because I want to repay right now Polish women for their help during 70s, for example, even 80s in some countries. So, the huge weapon across the world is the Solidarity movement. I think that we have to keep fighting, even if we just replace government and cover these gaps and help women. This is priority, of course, but we have to remember to continue fight, not to prolong this direct help to women, and said, we will organize everything, by ourselves. We will be helpful. We don't need the law. We don't need the government. No, not at all, because abortion is the first issue, extremely important. If they grab out all these women's rights, we will be back in patriarchal system. So a part of direct help, we have to continue just political war on regaining reproductive rights.
Thank you. Silvia, I think you wanted to say something also.
Yeah, I think just to follow up what Christina has just said, I think that solidarity in this case, with Polish or US feminist pro-choice organizations, of course, is crucial and is needed now, but this is not enough. I mean, I think that if we want really to defend and grant abortion rights, we have to do that in Europe and national levels, but also at the EU level, and we really have to build strong alliances because, anti-abortion movements are very strong and powerful and very well organized and very well founded, I don't know if you know the European Parliamentary Forum Population and Development reports. There are two reports that have been published over the last decade. One is called Restoring the Natural Order, an Agenda for Europe, that just presents, and explains how this Vatican-inspired global professional advocacy network which links groups from over 30 countries, has been created, and who is funding them, and what are their political objectives, which are basically to roll back existing laws on human rights related to sexuality, reproduction, and LGBT rights, and then another report, more recent, the tip of the iceberg, really investigating how these groups get their funds, which of course allow them to do public campaigns that are very powerful. Yeah. So I think that we really have to be aware of that, and but not become defensive. And I'm saying that because, for instance, for years I have been participating in discussions on the abortion law in Italy from '78, which imposes a number of the restrictions, like 7 days waiting period, also consensual refusal of care is not then so clearly monitored on the ground. I mean, there are several problems about the law and how it is applied or not applied. But nobody has never wanted to try to discuss the law in the sense of trying to modify it for liberalizing the law, and improving abortion access on the ground, as they have done in France, because they've always been afraid that some kind of right-wing force may then come in and manage to change the law in a more restrictive way. And now, I guess that with the new government that we've just had in Italy, it will be too late to try to do that for a while, I guess, And so I think that it is important to remember that laws can be changed. Actually, it can be also discussed whether we need a law, for regulating abortion. Actually, in Canada, they don't have one, and this must be discussed now without waiting until right-wing forces get more powerful and more organized and manage to kind of reverse or modify the laws and the organization of abortion care that we have in place. Yeah. So like gestational age limits at the end of the first trimester is just an example that we can make, I think that these limits should be discussed, and I understand that it's difficult due to this political landscape, but it's true that it's fragmented. So you have a terrible ban in Poland, but at the same time, abortion has been legalized recently in Ireland, and the Irish law is problematic, but still, this is a great success, right? So, I mean, we should be build stronger alliances, transnational alliances, and nourish each other in terms also of working together. Advocates, lawyers, politicians, and researchers, and supporting each other. Thank you.
Yes, I absolutely agree with you, and thank you for mentioning this report for IPF. I know them, and we also wrote our own report on the language, because our fundamentalists, they overtook human rights language. They just moved the human rights language from women to unborn child. So we know about this, and the other things extremely important about fundamentalistic organization is that they have a huge amount of money. They have in Warsaw, their office of Ordo Iuris, they have 60 lawyers working only on this issue, on family mainstreaming, and they also do the same in Brussels. So I totally agree that we have to collaborate closely on European Union and to push the EU to do something with women's rights, equal access to health services, or something like this, because they are very supportive. There were so many petitions, resolutions, solidarity words to Poland, but nothing else. And still we are pushed by fundamentalists to defend the rest of our rights in order just to stop us to go forward. So we understand this situation, that we have not to oppose every day, stupid idea on limitation our rights, but still go forward. And I'm very happy about the last announcement that abortion is a human right. But I would like to see this clear in WHO, UNFPA, also in the Human Rights Council, so in many UN agencies, as well as within the EU, that this is a human right. Thank you.
Thank you. So just maybe to wrap up and to give a last question in the round, we have been talking a lot about the policy level and the question of legalization and illegalization and prosecution, also the question of democracy and how abortion is being viewed inside the society versus what is being implemented. Also, Sylvia, you mentioned the case of Canada where there is no law. But what we see, and also what we worked a lot about when we made our film, is that we have a concrete problem of abortion providers on the ground, and that even in countries, and this is what you worked on, Sylvia, where abortion is legal, some people also end up traveling because they have no access to a clinic or to a person that can provide them with an abortion close to where they live. And that in Canada, this is also, for instance, the problem that there is also a difficulty of access because of this. So how do we work also with the medical professionals and make abortion a topic for them also, and to bring reproductive rights also in the medical field would be like one of my questions. And also maybe what are the other fields of society that we need to address as advocates for reproductive rights if we want to achieve reproductive justice or defend our rights in the society we live in? Like not only politics, not only solidarity networks, but what other fields of society do we need to enter?
Well, on a broader level in the United States, we will never achieve reproductive justice without dismantling white supremacy and undoing the history of racism and working to repair and make reparations for the history of racism and violence in this country. And, an immediate intersection I see of that is looking at police abolition and looking at how we can undo the history of police violence towards Black bodies in particular. Part of reproductive justice, as I'm sure everyone here knows and the watchers know, is not only, the right to have an abortion, but the right to have a child and the right to have that child in a safe and healthy environment. And you can't do that if, you are constantly under the threat of police violence that goes largely unchecked here. On another infrastructural level, I would also say clean drinking water and environmental protections. Natural disasters disrupt the ability to access abortion care terribly in the South, right? In places where there are increasing, levels of flooding and hurricanes and natural disasters that are happening because of climate change and the climate emergency, that directly disrupts people's ability to access all sorts of reproductive health care, including abortion care. So those are two of the biggest threats that I see to reproductive justice, and the areas I think that we should be focusing on urgently in this country, at least.
Christina, the floor is yours.
Yes, thank you. I think that we, in Poland, we have to approach closer medical staff, gynecologists and midwives, and the second professional group, lawyers. We have started this work, but it's extremely difficult because this generation of gynecologists and midwives, they had no mention on abortion during their study. We organized for them workshop on medical abortion, on abortion, different methods of abortion, because as they said us, they have 1 hour about termination of pregnancy during 6 years of studies. They have no information on emergency contraception as well. And emergency contraception is regarded by many gynecologists as early abortion pill. You know, that's not true, of course. And the second group, lawyer. So I would like just to join these two professional groups to work together and just to show rights, law, and access to health services. I would like them to meet in the middle and understand that they are, of course, I would like to have no law on abortion, but it would be probably the same situation as in Canada. I know I have friends working in NGOs in Canada, and they said me that women have been traveling thousands of kilometers to get access to abortion. So law is not good. No law is also not provide you with access to abortion. But, you know, still huge work in front of us and huge war for this. And first of all, I think that we have to educate medical staff and contact them with lawyers.
Christina, can I add something to what
Yeah.
you're saying?
Please, Silvia.
Yeah, because I was just thinking about, you know, the research that I have done previously on physicians and other health professionals' experiences and attitudes towards abortion and consensual refusal of care, particularly here in Spain and in Italy. And it's true what Christina is saying about Poland, also in these countries. And I'm afraid this is probably true also in other European countries, that there is no training as such, you know, on abortion care, abortion epidemiology, not even the medical aspects of it. I'm not talking about the social aspects of it, of course. So, and then people learn about abortion on the ground while they're doing their training, if they're exposed to it, you know, because then there are hospitals that do not provide abortion care or do not provide abortion care in the first trimester, or, you know, so then it really depends, you know, on where you are doing your training, basically, and it should not be like that, you know. And I also remember some young trainees in Italy who actually complained about that. They said that they would have liked to have also a proper debate and conversation about what abortion is, what abortion rights are, what sexual reproductive rights are, you know, and so to also be able to make a decision and decide whether to object or not based on something, you know, and not on the fear of being marginalized by the chief gynecologist who is an objector, or the fear of having to do only abortions that is, you know, boring, basically, these kind of things that they mentioned, you know. So I think that the lack of training is true, you know, and it's not only true for Poland. And also there is the problem that in some countries only one health provider can provide abortion care, like in Italy only gynecologists, but in others there is a wider range of health providers who can do that, like in France also midwives. And now with the new law they will also be able to be trained in aspiration and not only provide medication abortion if they want. GPs, you know, general practitioners can provide medical abortion in France. Here in Catalonia also midwives, you know. So again, it's very fragmented. Depending on where you live, you will have a wider range or not of health providers, you know. And then again, as the WHO has clearly stated, abortion does not have to be provided only by health professionals, you know. Medication abortion at home via telehealth can be safely provided also by non-clinical staff, and this is something that should also be said, and remembered, and it's important. And it's important, particularly, but not only in countries where there are severe restrictions to access. Yeah, and when it comes to the lawyers that Christina was referring to, I think she's right in the sense that when reproductive or sexual rights are violated, that you need to be able to denounce this. Point is, there must be someone denouncing this violation, and this is something that I discussed so many times with people from the Center for Reproductive Rights, for instance, in the case of Italy, where there have been also legal cases, for instance, of women who were undergoing a second trimester abortion for fetal malformation, which is provided in Italy only via induced labor, because health abortion providers are not trained to provide surgical abortion via dilation and evacuation like they are in Spain or UK or Netherlands or the US, and then this process would be interrupted several times, because there would be maybe only one gynecologist who would not object, and when this person goes home, then nobody would kind of continue to assist this woman, and there have been several cases like this, and there have been some denunciations, but there are only a few women who kind of feel strong enough to kind of denounce, the violation of their rights. And this is another part of the story, I think, that we should consider. And here is, I think, where all the support groups, all the feminist, helplines and chats, that have flourished over the last decade everywhere, not only in restrictive contexts, come in, can, I think, provide the kind of support that also people whose rights have been violated need to feel confident enough and strong enough to denounce this violation,
Thank you very much. Yes, thank you, Steph, also for bringing up the topic of racism, because actually Safe Abortion Day has its origins also in Latin America, and was chosen the date 28th of September. We should definitely remember this as the date of the abolition of slavery in Brazil. And it's the day of the free womb, so the moment from which also Black, formerly enslaved Brazilian women could decide if they wanted to have children for themselves or not. Yes, Silvia, also from picking up for what you said, empowering women and also breaking the taboo, I think, is a very important point. And whereas also my work also lies as a filmmaker, what we were also doing by creating a platform and amplifying the voice of those who've had abortions, like you said at the beginning of the panel, who are never involved into the discussions about the experiences that they make, and who actually have the expertise. I would love to see one day a whole parliamentary assembly of women and people who experienced abortions come together and draft the legislation and say, this is what we need to have safe and legal abortions, and this is what we want. Yes, so maybe just one sentence to close the round, maybe what you take away or what you want to give to our audience before we close the panel today. No one wants to say something?
Well, I can say something very briefly. I just repeating myself, but I think this is really important. I think that at the present moment, because of the challenges that we are facing, because of course the reversal of Roe versus Wade is a U.S. issue, but the U.S. has an enormous political influence over the world and also on Europe. We are actually allied, and we are in the NATO together and so on and so forth. I mean, we should be aware of that and of the dangers and risks that this may represent, in the sense that anti-abortion rights movements here in Europe may kind of feel confident enough, having seen what happened in the US, to try to move forward, and try to do something similar in European countries. So I think that we should be aware of that, and as I said, try to build a strong alliance, transnational, not only at national levels. I'm thinking of Europe, but not only, of course, and including all those people who can contribute, to show the damages that these restrictions to access to safe abortion imply, and that can actually fight for defending and strengthening abortion rights.
Thank you.
Yes, I totally agree. We have to build more alliances, not only on regional level, on European level, but also on international level, because this huge support and solidarity movement is very helpful for women fighting solely in one country. If they see that they are supported by others, they feel stronger. And the second extremely important issue for us is constantly raising awareness of the societies as a whole of the importance of women's reproductive rights, not only for women, but also for the whole families. Thank you.
And just to echo what both of the other panelists have said, we have an opportunity to build something bigger and better. We have the opportunity here to take all of the shortcomings of the structures and the systems of the past and do it right this time and do it better, which is a monumental task that can only be done with international solidarity. And I'm so honored to be a part of this panel that I feel like is starting some of that work.
Thank you so much. Thank you for your time, all of you, and for sharing your expertise with us tonight. I hope that all of our viewers also learned something, took something with them, and I invite also everyone, if you enjoyed this talk, share it with your friends, invite them to think about this topic and to show solidarity, because we all know someone and we all love someone who's had one or several abortions. Thank you very much.